Waking up with an erection, often called morning wood, is a common experience for men. This phenomenon, medically known as nocturnal penile tumescence, occurs frequently and is a sign of a healthy, functioning body. It's a natural physiological response that happens during sleep, particularly during the REM, rapid eye movement phase, when dreaming is most common. Despite what some might think, it's not something to be embarrassed about. In fact, it's a normal part of male physiology. Morning erections are a sign of good health and normal bodily functions. They indicate that blood flow and nerve function are working properly. Many men experience worry or confusion about their morning erections. They might feel self-conscious or unsure about what it means. They might wonder if it's normal, if it means they're overly aroused, or if others notice. These thoughts can lead to unnecessary stress. These concerns are understandable, but rest assured, morning erections are a perfectly natural part of being male. They are a sign that your body is functioning as it should. Understanding the science behind morning erections can help alleviate any anxiety and provide peace of mind. Knowledge is power when it comes to your health. In the following sections, we'll delve deeper into the mechanisms and implications of this natural phenomenon. We'll explore why it happens and what it signifies. We'll also address common misconceptions and offer practical tips for handling those sometimes inconvenient morning occurrences. Stay tuned for more insights and advice. The technical term for morning erection is nocturnal penile tumescence, NPT. This term highlights the fact that these erections occur during the night while you sleep. NPT is a complex process involving several bodily systems, including the nervous system, circulatory system, and hormonal system. During sleep, the brain goes through different stages, including REM, rapid eye movement sleep. REM sleep is when we tend to have vivid dreams. Interestingly, it's also the stage during which most NPT episodes occur. While the exact relationship between REM sleep and erections remains partially unclear, research suggests a connection between brain activity during this sleep phase and the activation of mechanisms that trigger erections. In the next section, we'll explore how blood flow contributes to the development of erections. To understand morning erections, it's essential to grasp the basics of how erections occur. Erections are primarily a vascular event, meaning they involve changes in blood flow within the penis. The penis contains spongy tissues called corpora cavernosa. When a man becomes aroused, signals from the brain and nerves cause the blood vessels in the penis to relax and widen. This widening allows more blood to flow into the corpora cavernosa, causing them to expand and harden, resulting in an erection. During sleep, particularly during REM sleep, a complex interplay of brain activity and hormonal fluctuations can trigger these same mechanisms, leading to nocturnal erections. Let's delve deeper into the role of hormones and sleep cycles in the next section. Hormones play a crucial role in regulating many bodily functions, including sexual function. Testosterone, the primary male sex hormone, is a key player in NPT. Testosterone levels naturally fluctuate throughout the day and night, typically peaking in the morning hours. These higher testosterone levels in the morning coincide with the increased likelihood of experiencing morning erections. Additionally, during REM sleep, the brain releases less norepinephrine, a hormone that constricts blood vessels. This decrease in norepinephrine further contributes to the relaxation of blood vessels in the penis, facilitating blood flow and contributing to NPT. The interplay of hormones and sleep cycles highlights the intricate connection between the brain and the body in regulating sexual function. Section 5. A sign of health, what morning erections tell us. Now that we understand the mechanisms behind morning erections, let's address their significance in more detail. Contrary to some beliefs, morning erections are a positive sign of good health. They indicate that the nerves, blood vessels, and hormonal systems involved in achieving an erection are functioning properly, which is crucial for overall well-being. For many men, morning erections provide reassurance about their sexual health and vitality. Regular morning wood can be seen as a natural check engine light for the male reproductive system, signaling that everything is working as it should. Of course, the absence of morning erections doesn't necessarily signal a problem, as various factors can influence this. However, if you notice a sudden or persistent change in the frequency or firmness of your morning erections, it's essential to consult with a healthcare professional to rule out any potential issues. This change could indicate an underlying health condition that requires attention, such as hormonal imbalances, cardiovascular issues, or other medical concerns. Section 6. Debunking the myths. Separating fact from fiction. Many myths and misconceptions surround morning erections. It's essential to address these myths and provide accurate information. One common myth is that morning erections are always a sign of sexual arousal or having a sexually suggestive dream. While sexual dreams can indeed trigger erections, they're not the sole cause of NPT. As we've discussed, hormonal fluctuations and brain activity during REM sleep play a significant role regardless of dream content. Another misconception is that the size or firmness of a morning erection directly correlates with sexual prowess. This belief is simply not true. Morning erections are a natural physiological response and don't necessarily reflect the size or firmness of erections achieved during sexual activity. Section 7. Erectile dysfunction and morning wood. When to seek help. While morning erections are generally a positive sign, their absence can sometimes indicate an underlying health issue, particularly erectile dysfunction, or ED. ED is the inability to achieve or maintain an erection firm enough for sexual intercourse. If you consistently wake up without an erection or notice a significant decrease in the frequency or firmness of your morning erections, it's crucial to consult with a doctor. They can help determine the underlying cause and recommend appropriate treatment options. It's important to remember that ED is often treatable. Several effective treatments are available, including medications, lifestyle changes, and therapy. Addressing ED early can significantly improve sexual health and overall well-being. Section 8. Age and morning erections, what to expect. As men age, it's natural to experience changes in sexual function, including a decrease in the frequency and intensity of morning erections. This decline is often gradual and is typically nothing to be alarmed about. However, a sudden or drastic change in morning erections, regardless of age, warrants medical attention. It's essential to maintain open communication with your doctor about any concerns regarding sexual health. They can provide guidance and support in managing age-related changes and addressing any potential health issues. Remember, a fulfilling sex life is possible at any age with the right information and care. Section 9. Tips for navigating the morning dealing with unwanted erections. While morning erections are a natural and healthy phenomenon, they can sometimes be inconvenient, especially in shared living spaces or social situations. This can be particularly true if you have roommates or family members around. Here are a few practical tips for managing those unwanted morning occurrences. First, give it time. In most cases, morning erections subside naturally within a short period after waking up. Your body will usually take care of it on its own. Simply give it a few minutes, and it will likely go away on its own. Second, shift positions. Sometimes changing your sleeping position or getting out of bed can help redirect blood flow and reduce the erection. Third, distract yourself. Engaging your mind in something else, such as reading, checking your phone, or meditating, can help take your focus away from the erection. You could also try deep breathing exercises or thinking about something non-stimulating. Remember, there's no need to feel embarrassed or ashamed about morning erections. They are a sign of a healthy, functioning body. They're a normal part of life and nothing to be overly concerned about. Embrace it as a natural aspect of your body's morning routine. Section 10. Embracing the normal. A positive perspective on morning erections. Instead of viewing morning erections as an inconvenience or source of embarrassment, try to embrace them as a positive sign of good health. They're a natural bodily function that indicates your sexual system is working as it should. Understanding the science behind morning erections can help alleviate any anxiety or shame you might feel. Knowledge is power, and knowing that these erections are a common and healthy phenomenon can empower you to approach them with confidence and acceptance. Remember, open communication with your partner about morning erections can also foster understanding and alleviate any potential awkwardness. Section 11. Conclusion. Morning erections, a natural and healthy phenomenon. In conclusion, morning erections or nocturnal penile tumescence are a natural and common occurrence for men of all ages. They result from a complex interplay of brain activity, hormonal fluctuations, and blood flow during sleep, particularly during REM sleep. While they can sometimes be inconvenient, morning erections are generally a positive sign, indicating healthy sexual function. Understanding the science behind nocturnal penile tumescence, debunking common myths, and seeking professional help when needed can empower men to approach this aspect of their sexual health with confidence and peace of mind. Embracing the normalcy of morning erections and maintaining open communication with partners and healthcare providers can contribute to a positive and fulfilling sexual life.